Welcome to this episode. Today we're diving into the Pediatric HESI Study Guide, a resource that's really about sharpening clinical reasoning and prioritization skills, not just memorizing facts.
Yeah, it's refreshing, isn't it? Because so often, nursing exams feel like a test of recall. But this guide pushes you to think like a nurse, to apply knowledge in real time, recognize patterns, and prioritize care safely. It's less about what you know and more about how you use what you know.
Exactly, and it's designed to complement textbooks and practice questions, but with a focus on how to think through pediatric scenarios. That's crucial because pediatric nursing demands a nuanced approach, especially when you're juggling developmental considerations alongside clinical urgency.
Speaking of which, the guide's clinical reasoning framework is a great mental model. It starts with the ABCs: airway, breathing, circulation, and safety. That's the foundation for every question. When you read a scenario, you slow down and ask, what's the child's primary problem? What's the most immediate risk? And what's the nurse's role right now?
Right, and that's where many stumble. They pick answers that are factually correct, but not the priority. The guide's step-by-step approach helps avoid that. First, identify the patient's age and developmental stage. Then, figure out which body system is involved. Next, recognize danger signs. Is the airway threatened? Is there deterioration? Then prioritize the most urgent issue. And finally, select the best immediate nursing action to keep the child safe.
That structured approach is like a mental checklist. It keeps you from missing critical priorities, and the developmental lens is essential here. Pediatric nursing isn't just about disease. It's about understanding what's normal for that child's age.
Absolutely. Misinterpreting normal developmental behaviors as pathological can lead to wrong answers and unsafe care. The guide breaks down key stages: infants with trust versus mistrust, strong attachment to caregivers and stranger anxiety, toddlers with autonomy versus shame and doubt, a strong desire for independence, and intense separation anxiety, preschoolers with magical thinking and fear of bodily harm, school-age kids who think logically and value routine, and adolescents focused on identity, privacy, and body image.
And that developmental context influences everything: communication, cooperation with care, emotional responses, even how kids react to hospitalization. So before answering, you always ask, what would a normal child of this age do or need?
That's a great point. Now, moving to high-yield conditions. The guide emphasizes recognizing key patterns and understanding basic pathophysiology rather than memorizing every detail. Respiratory conditions are a big focus because they're often urgent.
Yeah, signs like retractions, nasal flaring, grunting, decreased oxygen saturation, and increased work of breathing are red flags. Common conditions include asthma, which narrows the airway and risks respiratory failure, bronchiolitis, with mucus and inflammation risking hypoxia and dehydration, croup, with upper airway swelling causing a barking cough and stridor, and epiglottitis, which is a severe airway obstruction risk. And importantly, you don't examine the throat in epiglottitis, because that can trigger complete obstruction.
That's a critical nuance. Priority nursing actions here focus on positioning, oxygen administration, airway support, and minimizing distress. It's about stabilizing the airway and breathing first.
Then there are dehydration and GI conditions, very common in pediatrics. Key signs include dry mucous membranes, decreased urine output, lethargy, and in infants, a sunken fontanelle. Gastroenteritis causes fluid loss, and intussusception causes bowel obstruction. The priority is fluid replacement and close monitoring of hydration status.
Neurological conditions also have clear red flags: decreased level of consciousness, seizures, persistent vomiting, signs of increased intracranial pressure. Seizures require airway and safety priority, and meningitis adds infection and increased ICP concerns. The priority is airway protection, safety, and rapid intervention.
Cardiac conditions show patterns like poor feeding, fatigue, cyanosis, and edema. Priorities here are oxygenation, energy conservation, and monitoring for heart failure.
And in hematology and oncology, conditions like iron deficiency, anemia, sickle cell disease, and leukemia come up. Priorities include infection prevention, pain management, especially in sickle cell crises, and monitoring for bleeding.
The endocrine section focuses on type 1 diabetes. Hypoglycemia is an immediate priority. Symptoms like sweating, shakiness, confusion mean you give glucose immediately. Hyperglycemia or diabetic ketoacidosis presents with dehydration, fruity breath, and deep respirations. The priority is fluids first, then insulin.
That's a good example of how timing and sequence matter in prioritization. You don't jump to insulin before correcting dehydration.
Exactly. Now, the guide also covers grief, loss, and family-centered care, a vital but sometimes overlooked area. Nurses support children and families through serious illness and grief. Recognizing that grief is individual and variable, families may experience shock, anger, guilt, or sadness, and children's understanding of death varies by developmental stage.
Nursing priorities here include providing emotional support, allowing family presence and participation, using clear, honest, simple communication, avoiding false reassurance, respecting cultural and spiritual practices, and maintaining dignity and comfort for the child.
Communication overall must be developmentally appropriate, clear, simple, respectful, and supportive, including caregivers when appropriate, and tailoring communication to the child's level of understanding is key.
The guide also highlights SATA questions. Select all that apply. The advice is to evaluate each option independently, not guessing how many are correct, and focusing on safety, accuracy, and priority.
Common mistakes include choosing answers that are correct but not the priority, ignoring developmental stage, missing keywords like first or priority, and overthinking or adding information not provided.
So, effective study strategies are to review core concepts rather than every detail, practice HESI-style questions, and read rationales carefully to understand why answers are right or wrong. That's how clinical reasoning develops.
And the final reminder is important. You're not expected to know everything. You need to recognize common conditions, understand normal versus abnormal, identify risk, prioritize care, and think like a nurse. If unsure, go back to ABCs, focus on safety, and choose the most immediate need.
That really sums it up. Pediatric nursing is about balancing medical urgency with developmental and family-centered considerations. This guide gives a clear framework to approach that complexity with confidence.
Yeah, it's about internalizing that stepwise clinical reasoning process and always filtering through the developmental lens. That's what makes the difference in safe, effective pediatric care.
Thanks for joining us for this deep dive into the Pediatric HESI Study Guide. We hope this helps you think like a nurse and prioritize with clarity.
Take care, and good luck with your studies.